interested parties. Today we are going to be talking about our veteran-directed home and community-based services program that a couple of the CILs do. That would be Image Center and Accessible Resources. It is a program that is statewide, but more on that. Few housekeeping tips. You are going to be muted, if not already, and you can unmute yourself to ask a question if you need to. It's sometimes as easy as to put your question in the chat box, and so we will address questions at the end of the presentation so that we can make sure we get through all the material. And of course, if there's questions that go over our time or we're not able to get to, we'll make sure that there is appropriate follow-up with you. So stay engaged, and you might have to share your email with us if we run over. I think that is it. Without further ado, I'd like to have my colleague Pam Ford from Southern Maryland introduce our speakers. Take it away, Pam.
Hello, everyone. How are you doing? It's good to see everybody. I'm going to be introducing first Samantha Wilson. Samantha Wilson studied psychology at Morgan State University and proceeded to work in mental health rehabilitation at a Montgomery County residential rehabilitation program for adults. Samantha was enthused with assisting consumers with chronic mental illness, which resulted in a promotion to a supervisory role for the initiatives for the residential program. Where many opportunities were made available, Samantha's initiatives were to train, was to train, let's try this again. Samantha's initiatives was to train new employees, positively impact a greater number of consumers, and bridge the gap in integrating health services. Samantha then transitioned to Baltimore City to provide psychiatric rehabilitation to consumers ranging from 8 to 74. During this time, Samantha began to develop a passion for older adults and began working with older adult professionals and consumers. Through assisting the Behavioral Health Administration in their efforts to understand the impact on resources and services needed for older adults in the central region counties of Maryland. This catapulted Samantha into a position of leadership as the Residential Rehabilitation Program Director in Baltimore County and Carroll County, increasing her enjoyment and fulfillment in leadership and development. Samantha then joined the Maryland Department of Aging as the Veteran Directed Care Coordinator, the beginning part of the 2020 calendar year, dedicating her time and efforts to assisting veterans with their caregiving needs in a self-directed program. In addition to her professional experience, Samantha has become a trailblazer for the Christian Worship Center in Columbia, Maryland. After joining the church in September of 2016, Samantha has fulfilled many roles within the church, such as the Praise Team Ministry Leader, Acting Secretary, and Leadership Committee member. Due to Samantha's willingness to serve in various capacities, she has received recognition for leadership and excellence. This career path has also encouraged Samantha to enroll in the graduate program of University of Baltimore in Human Service Administration with a concentration in family and marital counseling. Samantha is expected to graduate with the Master's of Science in fall of 2021. Her contact information is Wilson, WILSON, B, Sam, all one word, at gmail.com or 240-426-1717. I present to some and introduce to others Samantha Wilson. Now on to Mika L. Wills, MA. Mika has been providing supports planning services to disabled veterans under the Veterans Directed Care Program, VDC, since June of 2016. She is employed by the Image Center of Maryland, which is a center for independent living located in Towson, Maryland. Under her role as a supports planner, Mika has worked with numerous physically and mentally impaired veterans to ensure that they receive the funding needed to obtain care attendant services within their homes. Mika is very passionate about working with individuals with disabilities, as she herself is an individual with a disability. Mika has a Bachelor's of Science degree in psychology and a Master's of Art degree in experimental psychology. Mika resides in Towson along with her husband and their 2 daughters. I now pass it on to, who's going first, Mika or Samantha?
I think Samantha was going to give us a general rundown.
Absolutely. If you can just bear with me as I share my screen. Can you all see the presentation there?
Yes.
Okay. Let me just go to presentation. Can you see that as well? Okay.
Yes.
Great. So thank you, Pam, for the introduction. It appeared that mine seemed to be a bit long, so I apologize for that as well. However, I do want to take a moment just to go over an overview and some information regarding the Veteran Directed Care Program. I appreciate the opportunity to present this information to you. And if you have any questions, please wait till the end and we'll be sure to get to those. So just a little introduction and some background information. The Veteran Directed Care Program started in 2008, which was as a nursing home diversion grant, which was created through the Community Living Program. And fast forwarding to 2010, that Community Living Program extended to add veterans programs, where a memo of understanding, which is that MOU, was signed with the VAMC, and MDOA, which is Maryland Department of Aging, and the VAMC were able to collaborate on these program materials. Fast forwarding to 2012, the ACL puts veterans programs into the ADRCs, and I apologize, there are tons of acronyms in the state of Maryland for a lot of these programs, so I will try to break them down as much as possible. So the ACL is the Administration of Community Living, and then the ADRC is the Area and Resource Centers. The first counties also began receiving referrals in 2012. In 2016, we had some adjustments to some of the federal regulations, which also included the Veterans Choice Act. So what are the goals of the VDC program? The participant continues to reside in the community living setting of their choice. This is a home and community-based program, and so the goal is to keep them, to keep all of our veterans at home as long as we possibly can, where they are comfortable and loved by their family members and loved ones. The participant's optimal level of functioning and independence is achieved and maintained. The participant is satisfied with services, and if applicable, a participant's unpaid caregiver receives relief from caregiving responsibilities. This is a collaborative effort. There are many individuals at the table that come together to really provide this VDC program. And so first we have the federal level, which is the VAMC, and also the Administration for Community Living, that ACL acronym again. And then secondly, we have the state, which is the position that I currently hold in our department, which is the Maryland Department of Aging. And then, of course, we have our MAP, the Maryland Access Points, which include Anne Arundel, Baltimore City, Baltimore County, Carroll County, Cecil County, Hartford, Howard, the Lower Shore, Prince George's County, and Montgomery County. And then we have our CILs, which is Image Center and ARI, who are hosting this lovely event today. Then we move on to our vendors, which is the physical intermediary, which we call Acumen. That is the company that we are contracted with. So they take care of a lot of the payroll needs for the program. Next is what services are available. The Maryland Department of Aging, through the local county area agencies on aging, assist in arranging self-directed services based upon the goals and preferences of the participant and or representatives. These services include personal care, homemaker, adult daycare, assistive technology, and home delivered meals. In addition to that, we also provide caregiver support, respite care, environmental support, other goods and services such as incontinence supplies, grab bars, ramps, or lift chairs, options, counseling and support services, and financial management services. The administrative responsibilities. All of our contractors have some responsibility in this program. So MDOA's responsibility is to meet the federal requirements, procure and manage fiscal intermediary contract, maintain the provider agreement, quality assurance, and liaise between the VAMC, the federal VA, in addition to our fiscal intermediary acumen. The VAMC's role is to process the referrals, approve budgets and services, fiscal policies and procedures, quality oversight, and enrollment and disenrollment. Acumen, our fiscal intermediary, manages veterans funds, payroll, employer and employee taxes, and pay vendors. What is the capacity of the VDC program? At this time, the goal is for each jurisdiction to have at least 5 referrals whenever possible. The VAMC serves 9 jurisdictions, as I mentioned before. Who is eligible? This is a question that the VDC program gets very often in terms of eligibility and enrollment and wait lists. And it can be a bit confusing for the average person coming in to utilize the VDC program. So I just want to take a moment to outline what that requirement is, and also how to move into the VDC program if that's something that you see or need at the time. So the VDC is targeted to participants and caregivers whose home care needs exceed the average hours generally available through home health aid, which is typically 15 hours a week. And at the VA, so the VAMC does provide the HHA service. The program is open to participants at any age and is not dependent on service-connected status. The program does not have a specific income or asset limit, and participants do not incur any cost to participants to participate in the program. So what is the criteria? There are multiple factors and exceptions associated with the program, but typically these are the requirements that make an individual eligible. Dependency in 3 or more activities of daily living, severe cognitive impairment, dependencies for ADLs, and significant IADL dependencies. So ADL is activities of daily living, and IADL are instruments of activities of daily living. And so these restrictions can change based on age. So if an individual is over 75, who is also experiencing clinical depression or receiving hospice care, they also will be able or be eligible for the program. So here's a longer list of what that criteria is. I'm not going to read all of it because it's a lot there. However, 2 things that I have starred here that are very important to notice is that the participants must be enrolled in the VA healthcare system and have a primary care team assigned. And I'm going to speak more to why that is so important. And then secondly is they require a nursing level of care. Without these 2 components, an individual is not considered eligible for the VDC program. In order for an individual to be referred by the community, we have a few steps in place. So first, the VA program coordinator receives a participant referral from the community. Secondly, the VA coordinator then reaches out to the veteran and does a screening. And then the VA coordinator then refers potentially an eligible participant to the social worker at the VAMC to complete the initial screening piece. This is the standard referral process. This is the referral process that we follow here at Maryland Department of Aging. And what that is that a primary care provider, social worker, or licensed independent practitioner completes a referral form in their internal system with the federal government. Then a consultation is then given to the individual in the program. Once the consultation is done, they then deem if the individual is appropriate for this level of care, depending on the level of need. If it is deemed appropriate, the program will then decide whether or not they would like to accept the individual into the program, and then they will then be placed on a waiting list if there is a waiting list at that time. They will then receive more direction if a slot becomes available. And so that takes me back to why it's so important for a veteran to be a part of the VA primary care team, is because it really helps with guiding them to receiving services. So that's why it's so important, because that form that they fill out internally will really make sure that it guides you to the next steps in terms of consultation. We currently at the VAMC that we work with, which is at Perry Point, they currently have a waiting list, and we are working hard to go through the waiting list to really bring down that list. So right now we do have a waiting list for those who are residing in specific jurisdictions. Each jurisdiction's waiting list is very different based on the jurisdiction's ability to take on more individuals. The length of this waiting list is dependent on the jurisdiction. So some are shorter than others. What's the veteran's role? The veteran's role is to direct the service and manage the monthly budget. As this is a self-directed program, this means that the veteran is the employer, and they also manage the monthly fund that comes or that is given through the VA to this individual. The employer also has the role of choosing and training its employees. So what's the bottom line? The participant-directed supports is self-directed. Veterans are responsible for managing all aspects of service delivery, and a personal attendant care and purchases, writing a budget, and chooses based on long-term supports and needs identified by the veteran. This is not a traditional case management program. However, the veteran has the opportunity to create the type of care needed. Thank you. And should I wait for Mika, Katie, before we open it up for questions, just in case she may answer any questions through her presentation?
Yeah, I think that's a good idea.
Okay.
Mika, are you ready?
I'm going to stop sharing.
Okay,
thanks, Samantha.
No problem. Thank you.
Hello, everyone. Again, my name is Mika Wills. I'm very honored and happy to talk to you today about my role as a supports planner, which basically what I do pretty much goes across the board for all supports planners. And I'll also give you some feedback on how some of my veterans, their families, feel about their participation in the VDC program. So just to give you some brief information about the Image Center of Maryland's participation in the program, we were actually one of the initial CILs who were signed up to start receiving referrals of veterans. At that time, this was around 2013, At that time, we had 2 supports planners, and we received 3 veterans. One of those veterans is still, as of today, an active veteran in the program. And at that time, we were also located in a very small office. However, we have, over the years, grown tremendously. We now have 5 supports planners, and we currently actively enrolled 29 veterans, and those veterans reside in Baltimore City, Baltimore County, and Harford County. So those are the 3 jurisdictions that the Image Center serves. Our veterans come from a diverse range of ethnic backgrounds, as well as various social economic levels. Some live with their spouses. Some of our veterans are widowed, while others live alone or with multiple family members. It's typical for most of our veterans to be at least 60 years old plus. Now, in terms of the role of the supports planner, we provide guidance, information, and support to our veterans and or their representatives to enable them to secure and direct their own care, as Samantha stated earlier. A representative is a designee who speaks on behalf of the veteran. So the representative basically takes over all responsibilities involved in the program, such as hiring and firing employees, interviewing, ensuring that they complete all program forms. The employers also would sign off on timesheets. And if a veteran does have a representative, that is the point of contact person that we as supports planners would contact, as opposed to contacting the veteran for decision making. Not that we wouldn't contact to say, check on a veteran to see how they're doing, because we do that. But if a veteran requires a representative, that is the person who we must turn to in terms of all decision making. Now, in terms of the referral process at the CIL level, so we received the referral from the Maryland Department of Aging. At the Image Center, Amani Graham serves as a supervisor. So she is the person who would receive the referral. Amani would then select the supports planner who would serve as the veteran's supports planner, I'm sorry. Normally she would pick, if say we receive a referral for a veteran in Harford County, because of the transportation limitations that it could take from getting from Towson to Harford County, that referral would normally be given to a supports planner who is able to drive out to Harford County. But other than that, there aren't any limitations in terms of assigning veterans to supports planners. Once that supports planner receives the referral, they make contact with that veteran, or if that veteran requires a representative, normally within a few business days. An appointment is made to go out to the veteran's home to start the initial enrollment process. Now, because of the COVID-19 pandemic, we have suspended all in-home visits. Therefore, we are completing these visits via telephone. So normally at the initial visit, the veteran or rep would sign an informed consent form. They would also sign several additional forms, such as a program application. We would begin the process of discussing the participant notebook, and we would also start to discuss the client's budget. Normally, at least for myself as a supports planner, I usually hold at least 2 visits at the veteran's home, because there's so much paperwork and information involved. Everything is not completed on the first day, especially since the veteran or their representative must interview and hire employees. It's definitely a process that takes several weeks. Along with the forms that take place during the initial visit, we also have to, once employees are identified, we must put them in contact with Acumen, the company that handles all the payroll, timesheets, and processing timesheets and things of that nature. So like I said, it's definitely a lengthy process. After that process of enrollment is completed, we as supports planners continue to provide services to the veteran on an ongoing basis. Those services do include monthly calls to check in on a veteran and make sure things are going well. At the Image Center, since the start of the pandemic, we have been doing more regular calls. So we've been calling our veterans at least bi-weekly. And oftentimes it's even more than that because needs typically arise, especially right now. So as much as our veterans need us, we are happy to be there for them. Normally, before the pandemic, we would complete quarterly visits. So every 3 months, we would go out to the veteran's home and meet with them. And if they had a representative, the representative must be present during these visits. So we would just make sure everything is okay, make sure the veteran is safe and being taken care of properly during these visits. Ongoing support also includes completing the annual functional assessment. So we complete the functional assessment to basically assess the veterans' activities of daily living. And that's done at the initial visits that I talked about earlier, as well as on an annual basis, just to see if anything has changed and if the veteran might require a different level of care, attendant services. We also renew the client's budget annually. However, for both the functional assessment or the budgets, if at any time throughout the year, even outside of their annual renewal periods, if updates or changes are needed, those can be done as necessary. We also provide ongoing support with with issues concerning completion of timesheets, any kind of issues with payroll, and also with onboarding of new employees with Acumen. We continue to do those services throughout, as I said, throughout the client's participation in the program. We also provide support that sometimes goes beyond the realm of the VDC program. For instance, I have a client who is visually impaired, and he's come to the Image Center on a couple occasions for different services. For instance, he's come to tour our accessible kitchen, so he can see if products were available that he could potentially use at home to become more independent. This same client has also come to the Image Center for training on how to use the accessibility features on his iPhone. And that same client actually just last week has asked me about services for him to take accessible computer training, and now I'm working on resources for that. We've also assisted veterans with getting in touch with their VA social workers, and we've also especially during this COVID-19 pandemic, provided information and referral numbers to obtain items such as meal boxes. Veterans typically, from what I've seen, remain in the program until either they may possibly have to go into an assisted living type, nursing home type facility, or unfortunately, some of our veterans do pass away while they are in the program, which is an unfortunate aspect of this program, because we do, as supports planners, become very close with veterans and their families. So sometimes that can be a bit difficult to deal with. I spoke with some of my veterans' families recently just to see how they have felt about participation in the Veterans Directed Care Program. Most of my veterans do have representatives due to their health needs. The first veteran who I would like to highlight is he's a 100-year-old male. And yes, that is correct. He is 100 years old and he's still kicking. He is widowed. He lives alone. However, he receives 24-hour care from hired attendants as well as his daughter. He's still mobile. However, he is hearing impaired and requires extensive assistance with ADLs. And he also has several health needs. His daughter states that his family is very blessed to benefit from the VDC program. They were very overwhelmed with paying for services before the VDC program. So the VDC program has definitely made a big difference in their lives. Another veteran of mine is a 90-year-old male who's also widowed. He lives in his home. However, his grandsons live with him to help provide care. He also has a full-time paid attendant who provides the necessary care that he needs as well. This client is a double amputee, requires extensive assistance with ADLs, and has extensive health needs that have to be addressed. His daughter states that his family is very thankful for the VDC program. Having paid care attendants allows for the family to have flexibility to be able to work outside the home and for family members to also attend social activities. Before the VDC program, it was quite difficult to manage full-time care for the veteran among family members. And the last veteran I'd like to highlight today is a 68-year-old male who is married, and he lives with his wife and mother-in-law. His wife is his primary care provider and attendant. This client is physically impaired, has a speech impairment, and requires extensive assistance with ADLs and has several health needs. Before he joined the VDC program, his wife had to work outside the home full-time, which left the client at home with his mother-in-law, who is an elderly woman herself. So the client had to stay at home either in his bed for most of the day or just confined to a chair. At the time, he had numerous health issues, and his recovery from having a stroke wasn't going very well. However, since this client had joined the VDC program, he's seen great improvement in his health as his wife was able to quit her job and is now able to stay home and provide all the exercise and therapy that he needs. This client recently lost over 100 pounds and is able to leave the home to attend social outings. And of course, that was pre-pandemic times. Now he's staying in his home, being safe. And as I've stated, many of my families are overwhelmingly blessed that they are able to be a part of the Veterans Directed Care Program. I've only received good feedback all the years that I've worked under this program. And as a supports planner, I can say that this has been a very rewarding experience for me, especially as I've developed close relationships with many of my families. I've attended a client's birthday party at a banquet hall, and I've also attended a memorial dinner for another client. Strong bonds are definitely formed. I myself hope to continue to serve those who have willingly served us. Thank you, and I'm happy to answer any questions if anyone has any.
Micah, maybe before you take questions, I want to make a couple of observations. Yes. When you think about how many veterans there are in the areas of Baltimore City, Baltimore County, Harford County, and Anne Arundel County, Howard, there are probably hundreds of veterans who could benefit from these services. So what you can do, if you're listening to this, shoot your senators and your representatives a note that says, we think that the veteran-directed care program is being delivered well, but we think it needs to be bigger. We need to be able to serve all veterans who have a need for care so that they don't have to go to dangerous nursing homes. Some of the nursing homes that the VA operates are among the most dangerous in the country. So there's never been a better time for people to advocate. We're not saying the VA is doing anything wrong. We're just saying we think they ought to do more, and they ought to be able to expand this program dramatically so that we can really serve all the veterans who have needs. So thank you guys very much. You did an excellent job on your presentations. I think this is a really important program that we're really pleased to do. We just think that there ought to be a lot more people who could benefit. Oh, and I guess the only question I have, and maybe one of you can answer it, is if I'm listening to this program or watching this program and I'm a veteran or have a family member who's a veteran and gets services from the VA, how do I get these services? What do I do in order to get the VA's attention so that they'll make me part of the veteran-directed care program? I don't know which one of you wants to take that one on.
So I will go ahead and take that question on, and Mika, please feel free to jump in or piggyback on this information. The first step is to get with your provider and request a referral internally to the VAMC so that they can then trigger a consultation where they can speak with you regarding your needs and where you are, but also consider what things you need help with and what things you would like assistance with when doing that consultation, so that you are able to paint a very good picture of where you currently are and what assistance would be beneficial with making sure that you are able to maintain your residency in the community.
And so I know this is a federal program, and you talked about all the paperwork that needs to be filled out, and you know, that's just part of the federal government. We get that part. How much time could I expect if I'm a veteran and I want to get in this program? How much time from the beginning of the process to when I'm finally signed up and this is happening? How long does that usually take? Any ideas?
So Mike, are you referring to more so how long, like, would they possibly have to wait on the waiting list, or from when we actually get
okay, so you raise an interesting point that there is this waiting list, and we really want that's another thing I should have mentioned a few minutes ago. When you talk to your senators, tell them that you think that everybody on those waiting lists should get off and be served. But okay, let's say I'm not on the waiting list. Let's say I'm getting ready. I'm starting the process of being enrolled, et cetera. How long does that take? A couple months, or a month, or 3 months? What?
Samantha, you might have more insight on that portion, since that would be on the VMAC side.
Okay, so I typically, the average amount of time that an individual takes to enroll into the program is somewhere between 6 to 8 weeks. And that's because the thing that takes the longest is typically finding an employee. A lot of veterans come into the program and they have some ideas of who they would like to hire, but sometimes it's not as easy securing those individuals to come in and provide that care. And so that takes a bit of time, but also going through the process of the paperwork. So the enrollment process, making sure your tax forms are in, making sure that you've completed the VDC application, making sure that you understand your role as an employer. That also takes time. And so typically we see about a 6 to 8 week turnaround before an individual is actually in the program. And that's on the fast side of finding an employee. We've seen individuals that have come or have been referred into the program, and sometimes they take 4 to 5 months to find an employee and to get into the program. So there definitely are barriers to being in a self-directed program in terms of being your own employer and finding your own staff. However, we do have some resources that we provide to the veteran and their families to make sure that they feel supported. We also check in to make sure that they feel heard and understand where they are in that moment to make sure that we can address those concerns and try to help them with turning things around pretty quick.
But if you got the resources and you know who you're going to hire, et cetera, it could be as little as 6 to 8 weeks. That's great. Thanks very much.
It just to add on, it actually could be shorter than that. I think the shortest amount of time I've had a family actually go from me receiving a referral to enrollment was around 2 weeks.
True, cool.
Yeah,
Right.
I really try to make sure, especially with their tax forms and Acumen paperwork, that I will look them over before they're submitted to Acumen, because everything has to be so precise. So we really, support planners really try to provide as much, assistance as possible to keep the ball rolling.
All right, folks. Well, anyway, folks, get to your congressmen, get your senators and representatives, tell them this is a good program and that you really think every veteran deserves it. Because I really do. I can't imagine the terror of being in a situation where I had to go into a nursing facility right now if I'm a veteran, and they don't want to go there. So hopefully we can expand this program and make sure that no veteran goes without services like this.
So question from the audience, and I think this one's going to go to Samantha. If a disabled vet lives in an apartment alone but has a need for someone to clean their apartment, I'm guessing, would they be eligible? This individual is independent with their ADL skills. Oh, you're muted.
Sorry, I was having a conversation with myself, it seems. So is the only thing that they actually need assistance with is cleaning?
I'm going to say yes.
Okay. In that case, I do not think that the Veteran Directed Care Program would be appropriate, mainly because the first thing is that you have to meet a nursing level home care in order to be in the VDC program.
But the VA does have other services that they can provide to keep people in their homes who just need these kinds of services. I'm not sure what they're called, but maybe you guys know that.
Okay. Any other questions from the audience?
There is a program that would help them, and I'm drawing a blank. Jerry, help me out. There's a program that the veterans can use. It's for, it depends on the percentage of the rating that they have, that will help come in with simple things. Jerry, help me out. What's it called? He's unmuting.
I believe under the aid and attendance.
That's it. So the aid and attendance program is based on even if you don't have a service-connected disability or you don't have a percentage rating, you can definitely apply for these benefits. They are income-based with your local CBOC, which is your community-based outpatient clinic, or with someone that can, from VA, that can help with your application process, that will help with someone in their home that needs help.
Thank you. And Pam, so Pam's kind of a veterans, well, Pam and Jerry, veterans benefit extraordinaires. We're very lucky to have them on the call. If people have specific questions about other VA benefits, what would be the appropriate way to kind of connect with someone who would be able to help them?
I would definitely send them to their CBOC. They're located everywhere throughout the state. And that's, again, your community-based outreach, outpatient clinic. To their local, they can go to the Veterans Center, the VA hospital. They have advocates everywhere. Here in the Southern Maryland, you can come see Jerry or I. You can go to NEB Vets, National Association for Black Veterans, VFW. Any of those organizations should be able to help you with the benefits that you require, or at least give you the information that you need that can direct you in the right path to get what you need. And service, you gotta just know the difference between a service-connected disability versus a disability that's not service-connected. And a service-connected disability is one that took place while you were serving in the military, where you got hurt, and that even if it did not affect you back then, it's affecting you now. You can bring up your medical records, bring up your history. So if those things are what you need to have in place, to have together when you go speak to a benefits counselor for veterans benefits. You also want to make sure that you keep a good documentation. And for those who are dependents of veterans, you qualify depending on the age that you became disabled. You became disabled before the age of 18. You qualify for benefits under your parents if they were retired or if they have a service-connected disability.
Pam, can I ask a question on that? If a veteran became disabled, had a stroke after the service, after they served, would they still qualify as a disabled vet?
It depends on the time and era that they serve, because there are some disabilities, what do you want to call it, Jerry? I'm losing my, that are automatic to, that are considered to be automatic. They are automatically connected because it happened. If, like, say for instance, Vietnam era, if you have something wrong with your heart, that's a result of Agent Orange. So if you had a heart attack, you served during Vietnam era, and you can prove that you served during those times, which is normally on your DD 214, then yes, it's service connected. You can be treated for it and have your doctors prove it. And if it can be proven that it was acquired during that time or as a result of your service, then it can be considered a service-connected disability.
A whole lot. That's a whole lot.
It's a lot.
And I think, for many of us, we become accustomed to the benefits side of non-military. And so there's a very specific kind of niche there of the military benefits that are available to the veterans. And so it's great to have that information. We have another question here. In regards to finding and obtaining someone to work for you, what are the requirements for someone to become employed? I don't know, Mika or Samantha, which one you...
I can answer that. So they definitely have to be 18 years old. They don't have to have any kind of licensures or certificates or formal training, because the employer can provide that training for the potential employee. They do have to fill out an I-9 form, so they do have to prove their citizenship status and tax forms and show ID or passport and things of that nature. So basically, as long as they have the usual criteria to apply for a job in the United States, is pretty much which would be sufficient. And as long as they're willing to obviously provide the care that's needed for the veteran. But other than that, there aren't any type of criteria. And actually, the attendant can be a family member, including a spouse. However, the care attendant cannot also serve as a representative for the client. So if you are representing the client under this program, you can't be a paid employee.
So as a follow-up to that, they said what training is required?
Yeah, like I had mentioned, pretty much none. Like some people think you need to be a certified nursing assistant or a GNA nursing assistant, but you really don't. As long as you're willing to be trained and work with the employer, it's basically up to the veteran or their representative, which would also be the employer. They are responsible for selecting who they feel is appropriate, but there's no hardcore training or anything that you need to come in the door with. It's pretty much what the family will accept and be willing to work with you.
Can I add on? So I'm from Virginia. I live in Virginia, and the program in Virginia runs pretty much like this. I love it. awesome program. One of the clients that I know had his daughter taking care of him. She did not live with him. She was not his representative, but she did everything from doctor's appointments to grocery shopping. It's whatever the veteran needs for that person that's taking care of that caregiver to do. That's what she was doing. When they switched out, because she couldn't do the 24-hour care, the next caregiver that came in would do the laundry, would clean the house, would walk the dog. It's pretty much almost similar to the self-supported DDA waiver, where you pick and choose what it is, what you're going to do with that pot of money that's being given to you. Samantha or Mika, correct me if I'm wrong, but that's how I understood it from the Virginia side. Am I correct?
Yeah, no, I would say that's pretty much correct. As long as you are hiring employees who will handle your ADL needs and, you know, any other needs that you may have within your home, including cleaning and other services that you may need, transportation and assistance to doctor's appointments, things of that nature. The funds can be used to pay care attendants for those type of things.
Well, I think we're coming up on the end of our time. I wanted to thank Samantha and Mika and Pam and Jerry. Thank you for all of your words of wisdom with regards to veterans and this program, which I think, you know, here's a quick question. So Kelly asked, if you're eligible for military pension as a dependent who is disabled, do you qualify for assistance?
Not through the VDC program. The VDC program is specifically for the veterans themselves. No, only the veterans, so no spouses and unfortunately no dependents as well.
But there are other programs out there for the dependents that they do qualify for. They can get aid and attendance. They can get other services, but specifically not that program.
So Kelly, if you let us know what county you're in, one of us will get with you and get you this, what did you call it? The CBOP?
CDOC, community-based outpatient clinic.
We'll get you the information for that so you can reach out to someone who might be able to assist you. So or do you want to?
Or you can send them to us because we're not county specific. Our veteran services aren't county specific. Jerry and I both work with NAB Vets, which works the entire state of Maryland outside of the CIL. So if they get to us, we can direct them to the right person that they need to get to.
Okay, so Pam, can you put your phone number and your email in the chat? So Kelly, make sure you take that down. And then I think we need to open it up to community announcements. Sarah, I think you had something.
I just have two quick things. Well, one quick thing, one longer thing. Thank you. The quick thing I put in the chat, but Independence Now is hosting our monthly liberation conversation. And today we're focused on the economy. So the session is this afternoon from 5 to 6:30 p.m. And there's a link there where you can register if you are interested in attending that session. I also just wanted to ask a more generalized question because we're encountering an issue, the Medicaid related issue that's come up. And I felt like this was a time to ask if people had, is that okay, Katie?
Yeah, go, okay. Ask away.
Okay, so the question is, I'm wondering if CIL staff, not my staff because I've already asked, but other folks are hearing or consumers of Medicaid services are hearing or having difficulty in getting gloves. We're hearing that Medicaid the state of Maryland has not only reduced the amount of money that can be spent on disposable medical equipment or medical supplies, but we're also understanding we're in a place where because of the pandemic, the cost of gloves has like tripled per box. And so I'm just kind of wanting to take the temperature and see if others are hearing that concern and experiencing it. I'm considering trying to do some advocacy around it, and I'll invite the other CILs, you know, to sign on once I get to that point. But just wondered.
So how do you want folks to get to you? This is an interesting issue. I saw something in an article the other day about this potential shortage and problems with accessing equipment. I'll have to find the article, but there's definitely a lot of talk out there. I just don't know what it means. So do you want people to contact you, Sarah?
Yes, that's fine. I can put my number and email in the chat, but if somebody has something that they can share right now, I'm fine with that too, so you don't have to later get in touch with me.
Anybody out there having trouble getting PPE, personal protection equipment, anything, gloves, masks?
This is Pauletta Shepherd. Can you hear me?
Sure.
Yep.
Pauletta Shepherd with the Freedom Center. Yeah, my daughter receives PPE, medical supplies, and so forth through Medicaid. And fortunately, I have not had a problem with the gloves. In fact, I had been receiving over the amount that Medicaid authorized, because the doctor, way back when, put in for additional. But now the authorization right now at this point needs to be authorized. And so I just told them for this month's delivery, just send me my regular number of boxes, and then I'll see if I can get them increased. But fortunately, at this point, I have not had an issue with the gloves or any of her other supplies. I guess I'll mute myself again.
I'm glad to hear that, Paulette. It's certainly not what we seem to be hearing.
Yeah, very fortunate for that. Yeah. Hopefully it won't change.
I know I had purchased gloves for one of our veteran-directed people, and it was $70 for 800 gloves, which is ridiculous. So the price of gloves has really increased quite significantly, and for those people who need them for their staff to support them, it's a problem. And so I guess Sarah and I were discussing earlier, like, is this a potential advocacy issue? Is this an issue that we can support as CILs to try to help people get the equipment that they need? So we're just trying to get a pulse on that. So Sarah put her direct dial and her email in the chat box. If anyone has anything else to add. Any other community announcements?
I just wanted to say I'm Lori from the Freedom Center. And I wanted to say that I'm having a problem with the gloves also. I had the first person call me up and say that they were buying gloves. They no longer could afford the extra gloves. They were getting 5 boxes a month, and now they've given them 1 box a month. And this past month, they did get 2 boxes a month. But where she's getting the extra gloves, and she's saying that there's now a black market out there for gloves. And she said, I don't really feel comfortable being, having to purchase gloves with my own money. And it's more money than I've ever paid for gloves ever before. So I am helping with her. And now that person has a service coordinator that has spread the word, I've gotten a couple of other calls also.
I will say the experience we're having is both people in the DDA system and people in using CFC or the community options waiver. So it doesn't, because Maryland State made the decision that they're going to pay 5% less towards these supplies for this year starting in July. So I'm also kind of wondering if it's just starting to shake out, if the rules change July 1, that we may start to hear it now. But I had the same thing. Somebody who gets 5 boxes is now getting 1 box. And it's somebody who needs 5 boxes and uses them. And the cost went from, $6-ish that they would pay towards it down to, less than 5, about $4, which doesn't, really doesn't buy you a box of gloves. So please, let me know. And CIL staff, feel free to email me if you have other stories. I'm kind of trying to build the case And this is the wrong time to not have enough gloves.
Yeah.
Sure.
Okay, other community announcements about events, activities your organization is putting on that you want to tell everybody about?
Yeah, I've got one.
Crosby.
Hey, I'm Crosby King and former chapter head of Maryland ADAPT, and we are trying to think about getting the chapter back together. If you're not familiar with ADAPT, it's a nationwide disability rights organization. We use local actions and national actions to get out there and make changes, social changes and physical changes like accessibility, curb cuts, ramps, things like that. And so if you're interested in getting either more information or interested in joining again, being part of us, let me know in the chat box, or you can email marylandadapt@yahoo.com. We're going to have a Zoom conference meeting next week. It'll be following the IAM meeting. And one more thing I should talk about. There's a little controversy in ADAPT right now. It's a national group split up into two factions. They both call themselves ADAPT. The smaller group is working strictly on federal legislation, and it's very, very confusing, and it's unfortunate. But I'm not with that one. I'm with a group that does actions. So I guess that's it.
Crosby, could you please put your contact information in the chat, please?
I will do that, yes.
Thank you.
Sure.
Great. All right, ladies and gentlemen, I think that we are done for today. We've only gone 4 minutes over, new record. Thank you everyone for joining us today. Make sure you register for each week's session. Next week we have, what do we have next week, Michael Bullis?
You're asking the wrong person. That's a good question.
It'll be great. Wait for it.
It's self-care. It's self-care.
Self-care, like meditation,
oh, that's right.
stuff like that.
Yeah.
Yes.
So, we got some great self-care routine and resources that Independence Now is able to coordinate for us.
Cool. Which is the perfect time of year because the days are getting shorter and we all need a little extra self-care these days. So join us next Monday, 2 p.m. And as always, Mike would yell at me if I didn't do this. Please, if you're able to donate, even if it's just $5, please donate. Your donations help make this program possible. We often have to pay for sign language interpreters or closed captioning. So, if you can just give us a little, we can continue to bring you this great program.
Posting the link for registration and donations in the chat box.
Thank you, Heather.
You're welcome. And we will be posting these videos on YouTube when we get them edited.
Yeah, usually takes a couple of days, but if you want any of our previous programs, if you want to see them, go to YouTube, to our YouTube channel, and there they are.
All right. Everyone have a great week until we see you next Tuesday.
All right.
All right, bye.
Next Tuesday? What?
Monday.
Monday.
What day are we?
Take care, everybody.
What day are we on?
Thank you.
What day is it? Help.